I'm Dr. Douglas Wood. I work in the Center for Innovation at Mayo Clinic, Rochester, where we are working on creating new solutions for healthcare delivery. The paper we're talking about today is Health Reform, a community experience using design research as a guide. And this paper will be published in the October 2011 issue of the Mayo Clinic Proceedings. This research actually was developed to help us better understand the needs of individual people living in a small Midwestern community, Austin, Minnesota, as part of a research effort to develop better delivery systems that would achieve the triple aim. And the triple aim actually implies being able to improve the experience of individuals with the healthcare delivery system, their health, the health of the population, and reduce healthcare costs all at the same time. In this work, we embedded a design researcher who actually happened to have training as an anthropologist in the community and observed how people in the community interacted with the healthcare delivery system, trying to get a deeper understanding of what health meant to these individuals, as well as what influenced their decisions to use healthcare. In that process, we tried to understand the differences in approaches that would have been based on gender or race or cultural background. We're also interested in understanding the differences that are imposed by income levels or education levels or other perceptions that people have about healthcare. There were several important findings from this research. The most important from our perspective is actually a better understanding of what health means to individuals. So rather than using a traditional definition of health, meaning the absence of disease, the best expression of health actually came from one of the participants in the research. And that simply says that health means I can do everything that I need to do so that the people who depend on me will be okay. This was a transformational finding for us because it meant that our orientation in healthcare delivery should be different than simply trying to meet process measures of how well we do diabetes care, for example, or even measures of hospital mortality or other community-based mortality. There are some other important findings, including that most people, regardless of their income or of their age or their gender or their cultural background, thought that the healthcare system is far too complex. And many people, in fact, even those who had insurance, would avoid going to see a doctor because of the perceived complexity of the delivery system or even the costs. So it's apparent that people have learned that once they go see a physician, there are additional costs that they may have to bear, either co-pays for laboratory or other diagnostic studies or for medications. Our goal in this research was actually to use the findings to develop what we call design objects that allow us to develop or design new delivery capabilities, either new delivery systems or new components of a delivery system that would better meet the health needs of the population we're trying to serve. It's an interesting way to do things. Design research is not often used in designing medical services, and so from our perspective, this is what makes this research actually unique. The work now is actually ongoing to begin to implement new delivery changes and service options that can really meet some of the specific needs that we identified in the population.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.